Hi there, how are you guys? I've started this video like 4 different times, and every time I start, something happens. The mic either doesn't pick up or it cuts off somewhere in the middle of it. And this is a hard subject. A lot of doctors, they don't really want to talk about it. Your friends, you get into a conversation and you start talking about it, and all of you guys get depressed, and you're like, we don't want to talk about this. This is a normal part of aging, menopause. You notice that your hair is thinning. You notice that sex is a little more painful, it's dry. You notice moodiness. You notice night sweats. Doctor tells you have osteoporosis. You can't sleep. All of these are stages of menopause. Okay. Before we go any further, like, share, and subscribe, especially share, because there's other women that are going through the same things and they don't know how to talk about it either. Okay. So what is menopause? It is a natural part of aging. It is the end of your reproductive years, and it's a pause in your menstrual cycle. Now, there's a couple different stages depending on who you talk to. Some people say it's 3 stages. Some people say it's 5 stages. It just depends on who you talk to. But the most important, the main 3 is irregular periods is what starts it. Hot flashes, mood swings. That's usually when you know your body is changing. Your hormones are changing. You're not producing as much estrogen, blah, 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 blah. So when you're in menopause, your ovaries don't release eggs and your body doesn't produce much estrogen, which we just talked about. A healthcare provider probably will diagnose you with menopause, but usually that diagnosis doesn't come until your 12 consecutive months with no monthly. Now, with that, of course, your hair thins, your bat wing shows up, you start to have low energy, depression, weak muscles, joint pain, all of these things start to happen. Then if you get lucky enough, you get on the other side of that, which is postmenopausal, you'll stay in that for the rest of your life, unless you have surgery and they remove your ovaries. But as soon as they do that, it's going to automatically kick you into menopause. So you're hoping the symptoms will get better. And I found out the hard way, trial and error. There is a way to make the symptoms get better. Okay. So let's start with, you always want to go to the doctor. You want to get some blood work. You want to see where your testosterone is, where your estrogen is, where your progesterone is. You want to find out all those things. Once you know that, then you start talking to your doctor about natural remedies, hormone therapy, and things like that. So let's start with black cohosh. Okay, you can get this in pill form. You can get it in a tea form, whichever that you like better. Okay, it is going to help with hot flashes, night sweats, insomnia, and depression and anxiety. Okay, now don't take this if you have a history of liver disease. Okay, you might want to try St. John's worts, and it comes in a tea form also. Okay, you might want to try salt palmetto. All 3 of these will help with the hot flashes and the mood swings. Okay, the good thing is you can get a pill form, you can get it in a tea form. Okay, you can also start drinking lemon balm tea. You want to drink 1 to 2 tablespoons. 1 to 2 tablespoons in boiling water. You want to steep it for 3 to 5 minutes so it can release everything. You want to drink 1 or 2 cups 3 times a day. Okay, it calms your nerves. It's a mood lifter. It helps with memory, concentration, anxiety, stress. But do not take it before you go to bed because you won't be able to sleep. Another thing you can get is red clover, ashwagandha. You've heard a lot about that. Both of those will lower your blood pressure, stress relievers. However, red clover you cannot take if you are taking anything that's a blood thinner, warfarin, or any of those, you can't take it. Okay. You also can get collagen powder. Okay. You want to look for collagen powder that has 1, 2, 3, 5, and 10 collagens in it. Okay. It's better than taking biotin. It will help with your hair growth. Okay. If you're having problems sleeping at night, you want to get magnesium. Okay. This will help you sleep. But when you take it, make sure that you're sitting down, ready to fall asleep, because it just relaxes you and you just fall right to sleep. Ashwagandha will work that way too. Now, if you're having a problem with energy, I suggest a B complex. You probably are taking a B12 shot, but the complex has B1, B2, 3, 5, 6, 12, and there's one more. Okay. The complex is going to have all of that and will help you get some energy. Now, I like ginseng too. I like both of these for energy. I also take a multivitamin that has energy. Okay. Anytime you're over 50, you want to add a multivitamin. So it's up to you. You want to add over 50, or if you want to add this one. This one, if you have caffeine sensitivity, don't take this because it has caffeine in it. Okay. You'll also find that you need to take some vitamin D. The doctor will tell you that. Take some vitamin D, especially with most of us working in offices under artificial light. You need to add vitamin D. However, vitamin D is not absorbed without vitamin K. So you need to take these two together. And both of them are oil-based, so you have to take them with eggs, avocado, coffee, or something like that so that they absorb. Now, I also take echinacea for immune. It also comes in a tea form. Okay. I also take, because it's flu season, it's getting colder, I also take a C vitamin. Okay. Now, you'll notice that because your hormones are out of whack, so is your sugar levels. So there's cinnamon. This is going to be the best thing for you if you're having problems regulating your sugar. Okay. You notice that weight gain, that little pocket that comes around at the bottom of your stomach? Berberine. It's going to help with that. It's going to keep your weight stable. It's going to help you lose some weight. Okay. Also with that, you'll notice that you've got body aches all of a sudden. That comes with osteoporosis. You may have neuropathy from having high sugar levels or diabetes or pre-diabetes, as the doctor likes to throw that word around a lot. You want to get some alpha lipoic acid. Okay. This is going to help with the neuropathy in your feet and your legs. It's going to help with the swelling. It is a wonderful, wonderful vitamin. I ran across it by accident and it has helped a lot. My legs don't go numb when I'm sitting too long. I drive a lot. So when I'm driving, my feet swell up. I get that numbness and they help a lot with that. Now, also with the thinning hair, and I have to turn around to get this. I talked about getting collagen powder. This is probably my favorite out of all the collagens that I have ever found. It tastes good. It's unflavored actually. So I just mixed a teaspoon in with my coffee when I have coffee, and it's just absolutely wonderful. There's also flavored. This is going to be the best for you because as you can see, it has 1, 2, 3, 5, and 10 collagens. And all of those do something different. But they will help with thinning hair. They will help with energy level. And these are the things that have worked for me. Okay. Now, we also talked about you get thinning skin when you start to get older. Okay. I also do a protein isolate. So sometimes I just don't feel hungry. So I'll do a protein isolate. So I was at work one day. I work at Goodwill, and this 2 sisters were in there, and they were like, "Her skin looks so good. She can't be our age." And I find out I was their age. So one of the sisters says, can I touch your skin? And I'm like, okay, that's a little creepy, but yeah. So she rubbed my skin and she was like, oh my God, it's so soft. And she told her sister to rub my skin. Her sister rubbed my skin. And I'm like, okay, are y'all getting ready to put me in a pot or something? You know, this is kind of scary. So I told them what I use. So I'm going to show you without a shadow of a doubt what I use every day. This is a cocoa butter stick. And what I do is I put it on my skin. Okay. When I come out of the shower, I do not dry off. I let my body naturally dries. I'll pat the thick water off, but I do not rub my skin to dry myself. Then I use a little bit of lotion. Okay. And when you think about lotions, you want to get something that has a cocoa butter. And because cocoa butter is real small, soft on your skin, you can get coconut oil, whichever one's your favorite. And I just put that right on top of the cocoa butter. Okay, that seals the moisture in, and that keeps my skin soft. I told the sisters that I was going to do this video and show them how I get that soft, shiny skin, and that's how I do it. Cocoa butter first with the stick, and then the cocoa butter lotion, so that I sealed all that in. Now, if you got any questions about any of the things that I just introduced today, talk to your doctor. Go get blood work. You should get blood work at least once a year. If you have any questions about using any of these together, talk to your pharmacist, and you can make a more informed decision. But these are the things that have helped me. And a lot of ladies have asked me, well, you know, these mood swings, these hot flashes, they're killing me. Again, that's going to be your black cohosh, which works very well, your St. John's worts, and your saw palmetto. Okay, these are things that are natural. You don't have to worry about hormone therapy when you start taking them. They work. Don't forget to like, share, and subscribe. Because if you think you're the only woman that's going through this, you're not. There's other ones that are going through this too.